Joe, take it away, my friend.
All right, thank you, everybody. Thank you. And Dr. Sabito, are you there?
Yes, I am.
All right, great. Let me just read your bio real quick, and then we'll just we'll do a little Q&A, answer some of the questions that a lot of people have been having. So I'm reading this off the internet, and I know it's current because you checked it for me. So Dr. Frederick Sabito, MD, is a board-certified general surgeon specializing in robotic oncological procedures. Dr. Sabito has been practicing for over 25 years in New York City and is a graduate of the prestigious 7-year Sophie Davis School of Biomedical Education and New York University School of Medicine Accelerated BSMD program. Dr. Sabito also owns one of the busiest hormone and longevity treatment clinics in New York City. So thanks, Doc, for coming on board. And so let's get right into it. I know you've been on the product for the last few months, and you've become a big fan of the Somaderm Gel for many reasons. And you basically feeling the benefits yourself. You told me yourself we had a nice long lunch a few weeks ago. And you think that this gel is more safer and more cost-effective way to benefit from HGH. Do you think the microdose might actually be the way to go and the way of the future? So, again, thanks for having us on.
Yes. With respect to how this is delivered transdermally, this is definitely safer than giving HGH subcutaneous injections. Back years ago, the National Institute of Health studied the use of gels in children who had dwarfism versus injectables and found that they were both as efficacious. The kids did grow with the gel. The benefit is that by having a transdermal delivery, you eliminate toxicity. So you get all the benefits of HGH. Now, we know as we get older that our growth hormone levels go to zero. But it does regulate our mood, fatigue, motivation, nervousness, lack of energy, muscle mass, body fat, libido, et cetera, et cetera. So with this, you don't get these side effects. You don't get water retention. You don't get carpal tunnel, tingling of the hands. You don't get acromegaly. There's no fear of growing cancer cells because what you put in transdermally is used over the next 18 to 24 hours. And I've proved this myself by drawing my own blood while being on this for 2 months. And my growth hormone levels detectable in the blood are zero, which means that whatever I'm using, whatever benefits I'm getting for that 24 hours are instantaneous, and then they're non-detectable. So there can never be toxicity.
Gotcha. So basically, what HGH you're putting in your body's actually using, and the excess HGH that you would get from a different procedure then, of course, could tax the liver, and your body's trying to get those toxins out. Makes sense. Okay, great. So there's other HGH products out there, over the counter. There's pills, there's drops, there's precursors. Some may actually contain some HGH. Why do you feel that the transdermal is the best way?
Well, pills, the absorption bioavailability of pills is very low. You actually lose 90% of what you ingest with an HGH pill. Your acid in your stomach breaks it down, and you don't achieve a blood level. The transdermal method, it's slowly absorbed across the basement membrane and taken directly into the bloodstream. Subcutaneously, if you do hit a vessel by mistake with a needle, obviously you get a big dose, but a lot of times you just get injected into the fat, and it's absorbed right into the fat and stays in the fat. Over time, you build a level, but it's not as instantaneous as with the gel, which makes it a tremendous product.
That's great. Now, you only stumbled upon this a few months ago, and what's been your personal benefits? I mean, your own actual testimonial. Well,
I was overweight. I was not operating efficiently anymore. I'm 53. I used to be doing 7, 8 cases a day. I was down to 4 or 5. I know that still sounds like a lot, but it's not when you're an operating machine like I'm used to being. And I was lethargic, muscle aches, losing muscle mass, increasing abdominal fat, etc. And I went on this, and everything seemed to reverse itself within the first 2 weeks. I could actually see the body fat decreasing. I had more energy. loss of any nervousness or anxiety, increased libido and drive. I had no trouble sleeping, was sleeping through the night, and it was very effective. And I was shocked that through a transdermal method I could get these kind of results. So I'm definitely endorsing this as effective and something that is going to be at every training table in the future. I think that the fact that I drew my blood and that the growth hormone level was 0 is very enticing to professional sports, NCAA sports. I think it's going to help athletes repair and have more energy, but it's not going to create any potential problems or give anybody an edge beyond their own biology. So no one's going to be able to come back and say that this guy's a better player because he's on HGH. If he gets injured, he'll repair faster and get back on the baseball diamond or football field, whatever. But he's never going to have a clear-cut advantage by being on it.
Okay, so, I mean, and you actually own an HRT, a home hormone replacement therapy clinic for the last year or so. And did you tell me that you actually were taking the injections and had to stop?
Yes. I actually were taking the HGH injections in conjunction with the testosterone. I had a severe reaction to water retention. I gained about 15, 20 pounds of water within several days. I went from a dose of 4 IUs a day down to 1. And anybody who knows anything about bodybuilding, that bodybuilders take 4 a day, and 1 is really nothing, should not cause any effects. Yet I was getting some symptoms of carpal tunnel and severe water retention, which I found amazing. I stopped it. It immediately went away. I did not get any of those effects with the transdermal gel that we have available. In terms of testosterone,
and I mean, obviously there's some skeptics to say that, well, it doesn't show up in your blood. It's because there's no HGH in there. So what comfort does it give you that to know that this actually is manufactured in an FDA-monitored plant and, you know, it's been registered, it's been selling for 7 years? Obviously that must go a long way. When you first heard about this?
Yeah, when I first heard about it, I mean, I looked up on the internet and saw, you know, 1 million HGH analogs out there, creams, gels, things that people were using, but none of them had this registered, you know, number, and that's because this is the real hormone. You know, you're actually giving the hormone that's made by your pituitary gland transdermally, which is unique. Mm-hmm. It's not an analog. Growth hormone is a 191 amino acid complex. It's very easy to modify, and you can modify it and think you're getting the same effectiveness. However, the receptors in your body know real growth hormone from not real growth hormone, mm-hmm. and that's the difference.
Yeah, and we talked a little bit at that lunch a few weeks ago about vitamin D. You know, my doctor, my regular primary care physician, who's not really, you know, into health as much as I'd like him to be, told me about 6-7 years ago to supplement vitamin D hormone. And if you Google vitamin D, I'm not the doctor, but, you know, vitamin D is a hormone or is very similar to a hormone. It's all over the internet just because, you know, your body makes it. Your body makes vitamin D in the sun. And so in the winter, you should supplement vitamin D because it helps the whole heart be stronger. And this is, you know, kind of a similar thing. Remember we were talking, Doc, about people saying, well, I don't want to put a foreign substance in my body, yet they take vitamin D. But this is not really a foreign substance because you still have it a little bit in your body, making hair and, you know, and making nails. So I guess that's a similar story, right? You were saying, you know, it's not really a foreign. I mean, Tylenol is a foreign product in our body. So why don't you comment a little bit about that, the fact that we have some HGH, it's just that a little bit more would be a lot better off.
Yeah, I mean, this is all about longevity, reversing the aging process, and what the benefits are. I mean, it's pretty clear that increasing your growth hormone levels after a certain age are going to make you live longer, are going to benefit your cardiovascular system. We've already proven with testosterone that it decreases your risk of atrial fibrillation by 21%, and it also makes males live 8 to 9 years longer. In addition, decreases your risk of breast cancer if you're a female by 96%, et cetera, et cetera. You get similar effects with the growth hormone, which is a natural substance made by your own pituitary gland. We lose it our skin gets wrinkled, our bones get brittle, we stop growing hair, we lose muscle mass, we gain abdominal fat, we have a decreased libido. All these are reversible with the real GH given transdermally. You're not going to get it any other way. And the nice thing is that you avoid the toxicity by using this micro dose, which is registered with the FDA, and that is the key.
Yeah, it is. And you did mention, not to go off topic here, but you did mention that women can benefit for a low dose of testosterone. Correct.
We find that women who have postpartum depression or who go through menopause benefit from testosterone. When you look at the studies, testosterone is the most common and most abundant female hormone. We used to think that giving women estrogen was going to stop their hot flashes and get them through their menopausal symptoms, but we find that testosterone does a better job, and all they need is a small dose. The average male needs about 300 to 400 milligrams every 2 weeks to maintain normal levels. Once he's deficient, female, maybe 20 to 30 milligrams every 2 weeks. I am, and we use the Harvard protocol in my practice. I can tell you one thing. I would never endorse any fly-by-night drug over the counter. I've used this Somaderm myself. I've seen the benefits. I see 500 patients per week in my testosterone practice. I am going to put this on the shelf for all of them to use and to better themselves. I made myself the guinea pig. I'm ecstatic with the results. I don't know what else I could possibly say. As a surgeon, it's going to make you a better person and healthier person all around.
That's great. That's great. I know. I remember hearing you immediately put in like 6 orders for 40 bottles, and then had to find out that we're out of stock. But that'll be gone in a couple of weeks, and it'll be on your shelf soon. So, Doc, I just want to say thanks so much. I know you're very busy. You probably want to relax, although you probably have more energy than you did 3 months ago, which is kind of neat. And again, sticking your neck out, and I mean, you obviously have an impeccable reputation, but feeling is believing, and looking forward to the next lunch, and also, obviously there's money to be made here too. I mean, you're not just a doctor; you're an entrepreneur as well. It sounds.
Yeah, that's another thing. This is my first crack at this. At multi-level marketing or whatever, and I would never do it. I remember growing up in the years of Amway with my parents, but this is something that I believe in. Whether I'm part of a big team or a big company, this product is the real deal. And like I said, it's going to transcend and be on everybody's training table. You're going to find that every university in the country, every professional team is going to have this on their training table for their athletes to use, and everybody's going to use. Is going to use this before getting up and going to work and having a great productive day. I can tell you from having a testosterone practice that it has grown by 20-30% every 6 months. Okay, wow. We have 20 to 50 new patients every month coming in to get testosterone, having all their symptoms reversed by a simple injection every 2 weeks. Once we add the HGH to this, I can't imagine how great they're going to feel.
Wow. Wow. And women, too. Women are actually coming in for the test, huh?
Women are coming in, and we find that 45% of my patient population are women.
Wow. Wow. All right, Doc. Well, thank you so much. I promised you 20 minutes, and that's what it is. I know you want to get back to your family and all that. And so that's a wrap, guys. Tomorrow we're having our webinar, our regular Tuesday and Thursday night 9 o'clock webinar. And Dr. Sabito, I can't, again, thank you enough. Have a great evening.
Thank you, guys. Thank you. Take care.
Bye-bye.